One of the main topics that I like to discuss is the vaccination program. Okay, so currently
Hmm.
our country's vaccination program, you could pretty much say, has stalled. We have been hovering around the 48% mark
Hmm.
for a good while now. So that and vaccine hesitancy has been identified as one of the challenges. So recently, the government has started taking stricter approach, which I assume you're aware of, such as implementing like the safe zone policies where only vaccinated persons are allowed to participate in certain recreational activity. And recently, they have basically made a push to vaccinate the public sector in terms of telling employees basically get vaccinated or be furloughed. I think the policy will be taking effect on the 15th, sometime at the end of this week. So
Yeah.
from your point of view as someone who of course have experience dealing with pandemics and so forth, do you think this approach is a solid approach for the government to get the country's vaccination program moving, like these restrictive
Hmm.
measures, or do you think they could implement other strategies that are less
Yeah. Now, Tyrell, you should also know that I've been interviewed on this subject by the other newspapers in Trinidad. So you should also pull up those
yes.
articles, The
Yeah.
Guardian and the which other? Oh, I did a lot for CNC3 TV. Okay, so that's on YouTube, so you can pull that up as well. Um, but we should probably do a step back and position the vaccine effort within the overall response. And so the overall response to a pandemic, and this pandemic is now entering its third year. That's like something the last time we experienced this was a long time ago for a respiratory illness, okay? We still have the HIV pandemic going on after 40 years. We actually celebrated the 40th anniversary of the first description of AIDS last year. But there are many, many other pandemics, all caused by infectious agents, that some of which go away. Remember that SARS-CoV-2, it's called CoV-2 because we had a SARS-1. It was called SARS. And that actually went away. Well, we can talk about why that is. So when you think about a pandemic with SARS-CoV-2 or the coronavirus that is going into its third year, there are a couple of things we should recognize. One is that every country has the opportunity to do well and to do badly. So the United States is a perfect example. It's a much bigger country, obviously, but there are times when we're doing well and times like right now when we're doing very badly. Okay. That's going to happen to every country. There's hardly a country in the world that has consistently done well. Taiwan would be an example. So you could look up Taiwan's coronavirus response.
I'm familiar with
Australia,
Taiwan and New Zealand.
yeah, New Zealand as well, and they're both islands. So in fact, islands have a unique opportunity to keep viruses out or keep infectious agents out. And some do and some don't. And much of that has to do with what we call the effectiveness of the response. Okay. So when you talk about a response, what is the response? Well, it's a very broad set of intersecting activities. Okay. First of all, you have to raise awareness about how this virus travels, how it infects people, what are the risks and susceptibilities involved, and then what happens after you become infected, how do you protect people from becoming infected when you are infected, how do you take into account the different age categories, because the way you deal with children is very different from the way you deal with adults. The way you deal with the elderly is different from the way you deal with the non-elderly. The way you deal with institutionalized populations is different from non-institutionalized populations. So you really have to think holistically, but you have to then segment into all of these groups. And then, we were very fortunate after 1 year of the pandemic to have effective vaccines being developed. And we can talk about that whole development story. And then, of course, it early on, it was all about access to those vaccines. Now it's all about uptake of those vaccines, okay? Once the access is solved, where you have enough vaccine, then it's about uptake. So vaccines, of course, constitute one approach, which is a biological prevention mechanism. And there are many other prevention mechanisms or mitigation that we use. Mitigation includes physical distancing, mask wearing, reduction in gatherings, and testing, access to testing, which is accurate and timely. Okay, so when you put all of that together, that constitutes a response. And then in addition to that, all of that is trying to prevent people from becoming infected. Okay, but once you are infected, you have to have a healthcare system that can deliver your requirements, which is primarily supporting lung function and with oxygen and other drugs, and any drug that will shorten the duration of symptoms and help to prevent the impact on the lungs. And all of that together is the hospital system. So in facilities, okay, and those facilities are usually standing hospitals, but you can extend that by putting up field hospitals or temporary facilities. So when you put all of that together, you get the response, okay? And then supporting that response has to be a whole series of things, supplies of everything, you know, PPE, that's personal protective equipment, masks, oxygen, drugs, any other inputs that you're required. Like, how do you give a vaccine? Well, you need a needle and you need a syringe and you need an alcohol swab, and you need to keep doing that over and over and over. So you have to do it in a safe environment. So that's one thing you need, supplies, okay, a supply chain. Then you need personnel. You need adequately trained and adequately supported personnel. Then you need information. Information is absolutely critical. So you're generating data as you go, and you're using that data, you're analyzing it, you're changing, you're improving, you are trying to do better all the time, okay? And there are many other inputs into a response, okay? And the pandemic has caused shortages of many of those inputs. So when you take that into consideration, we can describe what an ideal response has to be, okay? And then in addition to that, you have to sustain the response. Sustain means that you are trying to get the same quality or the same impact, even if it's going on for a long time, even if people are tired and fatigued. There's a lot of COVID fatigue. So you put all that together, you get a universe that looks like an ideal response, okay? But the only way to judge your response is by the numbers of people becoming infected, the numbers of people requiring support, the numbers of people who are going into hospital, and the number of people who die. And you have to construct what we call population rates with all of those numbers, so you can compare and contrast, okay? So up to this point, we're entering the third year. COVID response has been primarily emergency responses. And we can talk about the sort of legal and regulatory background that supports emergency responses. But as we go into a third year, this is becoming a sustained response. And that's where a lot of breakdown is taking place, sustaining the response, okay? So I'll stop there for a minute, and you have a sense of what the response has to be. Are you pretty clear about that?
Yes, I understand the response. So I guess this would be a good segue into asking you, how would you assess, not before we get to the vaccine, assessing Trinidad and Tobago's response into the pandemic so far? And as you say, we are supposed to now reach a place of sustained response. So do you think the country has reached, Please.
So the best way, as we said, is to look at the results.
Yes.
So by way of background, has Trinidad done a lot of investment into its response? Remember that death and disability are actually not the most important. First of all, they're preventable deaths and preventable disability, so they are important, okay? No one should be dying, but a lot of people are, so and that applies everywhere. But the biggest impact of the pandemic is actually social and economic. So we can talk about how the government has supported economically, and we can talk about how the government has supported socially. And we can look to social scientists and we can look to economists to say, how's the economy doing? You know, what's the state of mental health in the country? You know, are people blaming out? You know, how are they doing that? But the government in Trinidad has treated this as both a health response and an economic response, okay? So I'll leave the economics aside because I think there are other experts who can talk about that. But on the health response, initially, yes, they did a lot of good things. They set up a parallel healthcare system, which is very expensive to do. And we'll come to where it's breaking down shortly, but did they do a lot of the right things? Yes, they did. They did a lot of the right things. And I think initially we were seeing the impact of that, that it was, you know, they were getting a good report card. But what has happened since last June was that Delta came to Trinidad, like it did to many places, and Delta displaced the previous variants. And Trinidad has had a sustained Delta epidemic since last June. And there's no evidence that we are blunting that. Even today, when I think up to yesterday, Trinidad had 16 cases of Omicron. So Omicron is not replacing Delta. Omicron has replaced Delta in much of the United States. So we're seeing huge numbers of infections, but we're not seeing in many places, in some places we are, in many places we are not seeing the follow-up increase in hospitalization and death. But in Trinidad, this is consistent. We are seeing consistent high numbers of death in Trinidad. And if you look, the way to sort of position that is to look at the rate of death per 100,000 population or per million population. You know, one is just 10 times the other, right? And if you look at the Johns Hopkins website, or you look at the Oxford World in Data website, or any other of those, what I call aggregator websites, Trinidad is often at the top of the death rate. Often. Now, how do you interpret something like this? How would you interpret the fact that a small country like Trinidad, which is relatively wealthy, how do you interpret that they are often at the top of the death rate list? They aren't necessarily at the top of the infection list, but they're at the top of the death list. And that invites a certain amount of scrutiny. It says, and I have actually said this before in the Trinidad press, it is, why are we not getting the impact that we thought we would get from this parallel healthcare system? What is driving this breakdown? There are many ways to try to investigate this. Are people not, first of all, background, is Trinidad more, has more comorbidities than other populations? This is one way to look at it. And then you'd have to ask yourself, of all the people who died, how many of them had comorbidities? How do you distribute that over the age range, over the socioeconomic range, over whatever other significant factor there is, okay? Then you ask yourself, if they are everyone who dies entered hospital, and not everyone who died from COVID in Trinidad entered hospital, okay? Some people died at home. So is the system to evaluate whether someone needs hospital care breaking down? So people are staying at home or coming in late, too late to be saved. So that's another relevant question, okay? And then the third relevant question is, when people enter hospital, why can't we keep them alive? Okay, and that brings up a couple of things. Just getting rid of this here.
That's fine.
That brings up a couple of questions. One is, are we seeing a breakdown in the protocols that are being used in hospital? And because the protocols are meant to keep people alive, okay? So these are a series of cascading questions. And then the fourth question in this group of questions, talking about death, is, are we classifying deaths properly? Are these all COVID deaths? In my opinion, they are, and in fact, they're an underestimate. So you ask yourself, how many excess deaths from respiratory disease or cardiorespiratory disease does the country have? And you have to put all of this information together. And this is one of the problems that, you know, an outside observer like me has. I don't have access to the data set, okay? The data set is held by the Ministry of Health, and they therefore have to do these analyses. I don't see this kind of analysis truly being done. I see some analysis, there's no question. There's daily analysis going on. There's the epidemiologist at the Ministry of Health, Dr. Hines, and then of course the CMO and the PMO and the, but I would take a really good look at the data. One of the things I know from speaking to Christine Carrington at UWI, who is responsible for the PCR testing, not all the PCR testing, she does the sequencing. So she's the one who says, you have Omicron or you have Delta or you have something else, okay? But too often, samples that show up to her don't have information behind them. So the information integration seems to be way behind the 8 ball, okay? So many, and then you have to add the question of vaccination. Many of the people that show up late and show up in a bad state of deoxygenation are unvaccinated, okay? And again, with Delta, this is clearly the case in many parts of the world. Delta will hospitalize and kill the unvaccinated. Now that's interesting because when we talk about Omicron, we're seeing a lot of people who were already vaccinated getting COVID, but vaccination prevents them from severe disease and hospitalization. Okay.
So why do you think there is such a strong, hesitancy to the vaccine, and how could government?
So now we've come to this question.
Yes.
So essentially, we talked about in the early days, it was getting the vaccine from the source, okay? Multiple sources. And, there were issues associated with that. And there was a lot of demand. So people, we had allocation criteria. Those allocation criteria, included age, comorbidities, etc. Okay. And then after the initial demand was mopped up, when you got to about 45% of susceptibles and eligibles receiving their first and second doses, you hit a wall.
Sorry.